I'm Dr. Walter from SNS College of Physiotherapy, and today we are going to see another topic, that is Syringomyelia. Might be a new term which you might have learned earlier, but I'm going to refresh what we have learned in this Syringomyelia. So the students who are absent on the last days, make a keynote. What is this Syringomyelia? So it is completely going for a cyst which is affecting the spinal cord. Okay, so this is a common thing and a shortcut for the Syringomyelia. So what is this thing? What is the etiology, and what and all patients will be getting affected? What is the test? All these things will be learning in this slide. So make your notes for this Syringomyelia. Syringomyelia, pathophysiology. Straight away we are entering into pathophysiology. Why? Because the pathophysiology which is happening in this Syringomyelia is a different thing, so that we might have not even imagined how this will cause this type of cyst in the spinal cord. Okay, now entering this, it is a chronic and the progressive neurological disorder. It will be lasting for years and it will be progressing much and more, okay, leading to the weakness. Okay, syrinx means a cyst. This cyst will be covered with the CSF fluid. So the CSF fluid, the circulation of the CSF fluid will be going for a very much less in this Syringomyelia. Now, types of syrinx. Okay, types of syrinx: communicating syrinx, non-communicating, and the primary Syringomyelia. Communicating syrinx means it is connected with the fourth ventricle of the brain. It is communicating, but the cyst will be present in this area. Non-communicating, it is not connected with the ventricles, but here the CSF flow will be glowing down and the cyst will be present inside. Primary Syringomyelia refers to the clear identifiable cause, post-traumatic Syringomyelia. So why I am saying it is in the last? All these three, it is maybe due to the genetic disorder or any type of infection. Traumatic means completely going for the road traffic accidents, spinal cord injury, these types of things. Now, types which is creating the Syringomyelia: Chiari malformation, spinal cord trauma, spinal cord tumors, and the inflammation in the spinal cord. So these are the types which will increase the Syringomyelia. Now, clinical presentation. So what will happen in the sensation, in the motor things? Sensory deficits will be going for the loss of pain and temperature, autonomic dysfunction, that is oversweating, and all these things will be bladder bowel dysfunction will be happening. Motor weakness and the atrophy will be developing to the lower limbs, and the pain, neuropathic pain. So worst thing for the Syringomyelia patient. Diagnosis, which is going for the MRI scan, electrophysiology, that is the EMC studies, NCS studies, and the differential diagnosis to rule out the Syringomyelia. Medical terms. As we are learning the physiotherapy field, we need to learn certain things about the medical terms. Surgery interventions, that is the most advanced stage in which the posterior fossa will be getting opened by the neurosurgeons, and the decompression of the Chiari malformation will be happening. Monitoring and the follow-up and the medical management, there is no such proper treatment and proper drug medications for the Syringomyelia. We need to control the neuropathic pain. Rehabilitation, as physiotherapists, we need to rehabilitate on the motor weakness. Okay, so what are the motor weakness? What are the techniques which we are going to? Strengthening exercises, passive movements, PNF patterns, stretching exercises. These techniques will be helpful for the physiotherapy protocol things. As students, this Syringomyelia will be asked in your examination, and this is a new upcoming and the blooming condition onto the world. So we'll meet onto the next class with a new video. Thank you.